everybody. Welcome to this second session. The first scenario is going to be with a patient who is unconscious, admitted to the emergency room or outpatient department of the clinic, and the physician takes some blood samples and some swab materials, microbiological samples, which were sent to the laboratory. And first results were reported to the clinician within 30 minutes. And later, the complete laboratory results were submitted to the physician. And the first results were quite concluding to treatment option he chose for this patient. So patient was transferred to the ICU, and on second day, patient had a worsening condition, presenting with fever, headache, and nausea. And the doctor started calculated treatment with antibiotics due to the symptoms the patient presented. So additional lab results were available on second day. Patient situation worsens again, and he received, instead of the calculated treatment, antibiotic treatment, treatment with reserved antibiotics, which you normally don't give at first or second level. And the new ASP system, which you are requested to develop, should detect on arrival of the patient by the use of non-invasive sampling that there is an infection with multi-drug resistant microorganism, and the system should tell which organism it is and in which compartment of the body it is affecting the patient. And the system tells the physician which antibiotics are recommended according to the results, definitely, and whether isolation or cohort isolation is possible, or if isolation is not needed at all. The second scenario is presenting a lady who is hospitalized and laying down in a normal ward, and the professional, that is the doctor, is entering the room where the patient is lying and performing the usual interventions, checking and maybe doing some anamnesis. While doing that, he has contacted the patient, definitely, because he has to check what is happening in this patient. And then he had also contact to the surrounding of the patient, which can be also contaminated with different pathogens. He's then leaving the room. The next day, the professional is not feeling well. That comes also, or occurs also once in a while. And it will be identified that he was carrying MRSA. Well, MRSA is not an issue nowadays, but it's still circulating in hospitals and in the community. Another 24 hours later, the patient is having symptoms of respiratory infection, for instance, coughing and developing fever, and when you see the chest X-ray, there will be infiltrates also. Additional lab results reported. Patient's situation worsens, and the patient receives the so-called reserve antibiotics. And now the question is there a system, an anti-superbug system, which can detect MRSA on arrival of the patient within few hours or maybe within few minutes, because some systems can also detect the pathogen within 20 minutes. And the patient should not suffer by giving the sample or being sampled for the analysis. It should be non-invasive. And the system, as in the first scenario, should detect the pathogen and should tell the physician which compartment is associated with this pathogen, or where the infection is occurring in the body of the patient. And then the same thing, you should give recommendations whether the patient has to be isolated or not. You think, well, definitely, it's quite similar to the first scenario, but you think that there will be a possibility for you to use your system or technology to detect, quite easy from sputum or any secretion sample from the patient to detect the pathogen?